Approximately 15% of couples do not conceive after 12 months of unprotected, regular sex. By this stage, women have usually discussed their desire to have children with their gynecologist during their routine examination. They should do so especially if they have reasons to be concerned about their fertility, for example, if they have had cancer treatment, or if they are over 35 years. About 40% of the issues involved with infertility are due to the woman, another 40% due to the man, and 20% result from complications with both partners. Fertility testing and investigation can be a lengthy process, and female fertility decreases with age, so it is best to discuss this early on. The process of trying to conceive can be emotional, so it is important to get as much support as possible. Stress is just one of the many things that can affect fertility. With the aid of a few quite simple questions and tests, the GP or gynecologist can determine possible fertility disorders in women and set the couple off on the right fertility path. Below are a few areas your doctor consider when trying to identify why you are not pregnant yet. Medical, sexual and social history. When a woman visits her GP or gynecologist to inquire about her fertility, the doctor will want to discuss her full medical, sexual, and social history. This will help your doctor identify what may be causing fertility problems. Age. Natural fertility in women rapidly declines with age, and the doctor will evaluate the chances and risks of a pregnancy based on the couple's age profile. Children. The doctor will discuss any previous births and any related complications with previous pregnancies. The doctor will also ask about any miscarriages. Irregular menstrual cycles. If the woman's cycles are longer than on average, mathematically she may only ovulate every 6 weeks or about 9 times a year. She will therefore have fewer opportunities to conceive. This is a statistical disadvantage in a numbers game of probabilities. For this reason, women with long cycles are sometimes given fertility drugs like Clomid to regulate ovulation. Women over 35 and don't ovulate regularly are the most likely candidates for drug therapy. Length of time trying to conceive. The GP will ask how long the couple has been trying to conceive. This graph shows the average percentage of fertile couples achieving pregnancies after sex. Couples may be asked how often they have sex, and whether they have any difficulties during sex. They may feel uncomfortable or embarrassed about discussing their sex life with their doctor. However, it is very important to be open and honest. If the fertility problem is caused by sexual potency or motivation, this might be easily overcome. Time since stopping contraception. The couple will be asked about the type of contraception they previously used, and when they stopped using it. It can sometimes take a while for certain types of contraception to stop working, and this may be affecting current fertility. Medical history and symptoms. The doctor will discuss any medical conditions the couple may have, or have had in the past, including sexually transmitted infections. The doctor may also ask how regular the female's periods are, whether she experiences any bleeding between periods or after sex, about previous miscarriages, including ectopic pregnancies, infections and operations. Medication. The side effects of some medications can affect female fertility. The doctor will look at any medication the woman is or has been taking, and might discuss alternative treatments. She should mention any non-prescription medication she is taking, including herbal medicines. Habits. Several lifestyle factors can significantly affect fertility. The GP will want to know if one or both partners in the couple smokes, how much they weigh, how much alcohol they drink, whether they take any illegal drugs, if they are stressed privately or at work. The doctor may recommend changes to the couple's lifestyle to increase their chances of conceiving. Basic physical examinations and tests. After discussing the couple's medical, sexual, and social history, they may be referred to a fertility specialist for further tests and procedures. Physical tests. The doctor will also examine the woman's pelvic area for clues about possible problems. Checking for infection, lumps, or tenderness, which could be an indication of fibroids, ovarian tumors, endometriosis, or pelvic inflammatory disease. Hormone tests. Blood tests taken at various times in the cycle can provide clues about fertility problems. The female's blood may be tested for progesterone, to check whether she is successfully ovulating. The timing of the test is based on how regular her periods are. If she has irregular periods, she will be offered a test to measure messenger hormones called gonadotropins, which stimulate the ovaries to produce eggs. It is also often advantageous to regularly measure the classic parameters of FSH, LH, estrogen, and progesterone, as well as controlling a variety of other factors such as the regular functioning of organs. This is because even slight hypothyroidism can be responsible for disruptions in a woman's cycle. Checking the ovaries. The woman's ovaries will be tested before she is offered fertility drugs. This may be done via a blood test to measure certain hormones or an ultrasound scan to examine the follicles in the ovaries. 30% of infertile couples are affected by ovarian conditions. Chlamydia test. Chlamydia is a sexually transmitted infection, which can affect fertility. The gynecologist or sexual health specialist will take a swab, similar to a cotton bud, but smaller, soft and rounded, to collect some cells from the cervix to test for chlamydia. If chlamydia is diagnosed, prescription antibiotics can effectively treat it. During this session other standard checks will be performed including for herpes, gonorrhea, syphilis and HIV using urine and blood samples. Hysterosalpingogram. A hysterosalpingogram is a type of X-ray taken of the uterus and fallopian tubes after a special dye has been injected. This will outline the cavity of the womb and detect any blockage of the fallopian tubes. 25% of infertile couples are affected by tubal diseases. In addition to the endometriosis conditions such as fibroid and polyps, adenomyosis can also lead to the obstruction of the uterus and fallopian tubes. A pap smear, which can be conducted during a routine gynecological investigation, can be used to diagnose bacterial infections, fungal infections or cell changes, which in some cases can indicate a disorder affecting fertility. Most doctors conduct an HSG ultrasound scan as part of the first fertility diagnosis. This helps with the detection of myomas, endometriosis and malformations of the uterus. The HSG will also visually represent the development of maturing follicles and the construction of the endometrium for examination. 10% of infertile couples are affected. Watch the next video about the frequently asked questions about fertile period. Remember to subscribe, like and comment. If you have any questions, kindly comment below this video or on MOXIBER.com. A doctor will respond as soon as possible. Thank you for viewing.